Traumatic brain injury (TBI) has disabled 1 to 2% of the population, and one of their most common disabilities is problems with short-term memory. Electrical stimulation has emerged as a viable tool to improve brain function in people with other neurological disorders. Now, a new study in the journal Brain Stimulation shows that targeted electrical stimulation in patients with a traumatic brain injury led to an average 19% boost in recalling words. Led by University of Pennsylvania psychology professor Michael Jacob Kahana, a team of neuroscientists studied TBI patients with implanted electrodes, analyzed neural data as patients studied words, and used a machine learning algorithm to predict momentary memory lapses. The last decade has seen tremendous advances in the use of brain stimulation as a therapy for several neurological and psychiatric disorders, including epilepsy, Parkinson's disease, and depression. Memory loss, however, represents a huge burden on society. The researcher says that we lack effective therapies for the 27 million Americans suffering. The top causes of TBI are motor vehicle accidents, which are decreasing, and falls, which are rising because of the aging population. The next most common causes are assaults and head injuries from participation in contact sports. This new study builds off the previous work in 2017. They showed that stimulation delivered when memory is expected to fail can improve memory, whereas stimulation administered during periods of good functioning worsens memory. The stimulation in that study was open loop, meaning it was applied by a computer without regard to the state of the brain. In a study with 25 epilepsy patients that was published the following year, they monitored brain activity in real time and used closed loop stimulation, applying electrical pulses to the left lateral temporal cortex only when memory was expected to fail. They found a 15% improvement in the probability of recalling a word from a list. But the new study specifically focuses on 8 people with a history of moderate to severe TBI who were recruited from a larger group of patients undergoing neurosurgical evaluation for epilepsy. 7 of the 8 are male, and the researcher says 80% of people who get hospitalized for traumatic brain injury overall are male. Kahana emphasizes the importance of addressing TBI-related memory loss, noting these patients are often relatively young and physically healthy, but they face decades of impaired memory and executive function. The researchers' primary question was whether stimulation could improve memory across the entire list of words when only some words were stimulated, whereas prior studies only considered the effect of stimulation on individual words. This development is important because this suggests that an eventual real-life therapy could provide more generalized memory improvement, not just at the precise moment when stimulation is triggered. The study notes that more work remains before this kind of stimulation can be applied in a therapeutic setting, and scientists need to study physiological responses to stimulation to better understand the neural mechanisms behind improved memory performance.